Jamil Mahmood. Thank you for being on the BeCause and Effect podcast. Welcome to the show. We wanted you for so long and we finally got you, so I appreciate it.
Thanks for having me.
Well, I've wanted to have you, like I said, because every time I've talked to you at an event or, seen you speak at an event or anything, I've always loved the vibe you put out. I've always loved your philosophy on things. So as this new role that you've taken, for people who don't know, just took over the executive director of Main Street Project, I think January, or was it?
Yep.
Yeah.
Yep. January 4th.
So you've been there for, I guess, by my math, maybe 4 months now. Give me a rundown of how the last 4 months have been for you in this new role, and how are you handling things?
It's been great. I didn't know what to expect fully. You have some insight, you have some pre-conversations, but starting a role in a larger organization like Main Street Project, that's like 24 hours, emergency response. It's, you never know what to expect. But I think the biggest things I learned quickly is the team here is super strong. There's a good core of directors that have been here for a while, and the programming end of things is amazing, and our staff are just amazing. So I quickly felt comfortable coming in because I knew I didn't have to jump in any large way, that they've been functioning for a while. There's a little period of break, and then there was some support from Bobette from Uncommon Clinic to help with the director role. And so I joined a team that is strong and amazing people, and just the staff in general is amazing. So that was easy. It made it easy to come in and know that I could take time to learn, read, get caught up, had that time to get in the role. And it's been great. Had to do a budget before the end of March. And so that's a new process with an organization you've only been with a little while. And so, so definitely some things I would do, with more time in the future, and already planning what that looks like for next year. But so coming in, really excited for this work, and have an amazing team here. So it's easy to jump right in and just hit the ground running.
That's awesome. Yeah. What have you learned, or what is different, I guess, from Main Street versus Spence Neighborhood Project, where you were the former executive director? Maybe a little bit bigger scope, but same style of work, or what's the difference so far?
Yeah, I think there's like a general theme of not-for-profit kind of community-based work, and so that's the general theme that I think carries through. But the size is different. This Main Street Project is more than double the size of Spence in terms of budget and staffing and operations. So bigger operations. There's different layers of administration and other work. So at Spence for a long time, you're as the executive director. When I started there, we had eight to 10 staff, and when I left, we had 75. But like a lot of the administration was just built on, me working extra or other managers working extra, kind of filling that gap where there's a little more support for that here in the organization structure, framework, and funding, right? To just have that administration that you need to run an organization. So. Right. System like that is the biggest difference, I think. And then, there's roles in healthcare, and I'd done in between Spence and here, I'd worked for the Winnipeg Regional Health Authority Street Connections program in public health. And so I'd kind of been dipping my toes into the health world, but there's more health focus with our work with, addictions and detox and that kind of work. And so I still feel like I'm still catching up on those kind of that world of health organizations. There's a community. There's the community health associations and different groups. So kind of different networks I'm joining and learning and being a part of, and so there's kind of that growth in that area as well.
That's such a gigantic world to figure out, and it's such a big picture. That's kind of where I was wanting to go next when it comes to COVID-19 and sort of how. I want to talk a little bit about how it affects different populations differently. And I think you have a good insight into that. There's different degrees, let's call it, of difficulty for people. So maybe just talk about what you're seeing when it comes to COVID-19 and how people are handling things, and maybe some of the problems that are and challenges that have come up that most people may not even be aware of.
Yeah, I mean, I think that like that to me it was like the biggest, biggest kind of hit to like learning quickly is like I had to quickly get caught up on all the COVID response in the homelessness sector and Main Street Project, like the work they've done this past year. You know, obviously not with me here before me, but that was just amazing. Like the Main Street Project supporters, people in the sector, just like we went from a shelter of 75 people at Martha Street to turning a warehouse at 190 Disraeli through a generous donation from, from a local businessman to give us that space to over 200 shelter beds, distance apart, 6 feet apart, separate male and female floors, building washrooms and showers in a warehouse, like it wasn't built for that reason, right? And so like that expansion, then opening isolation. Friday is our 1 year anniversary since we opened our first isolation site for the homeless sector. So opening, one isolation site, and then in October when numbers went up, we were able to open a second one, and just that whole process of that work really just is amazing. And I can't say it enough that what they did in Winnipeg, Main Street Project staff and the support of our partners really saved so many lives. And really, if you look at the outbreak in the homeless population, it's relatively like low to almost non-existence besides that blip in October, November, compared to other cities, right? With homeless populations, and you see what happened. And we were able to take what they learned in Toronto and apply it here immediately and use those lessons to make sure we didn't end up with the COVID going right through our whole population, and by being able to space out shelters. And then we did, in that time, we renovated Mitchell Fabrics building and got that space up and running, to the point now that's 120 shelter bed space there. 10 washrooms, 6 showers, like just an amazing facility for a shelter. And then now we've closed down the 190 as of March 31st. Disraeli buildings. Now we're all at Mitchell Fabrics, and so just thinking, comparing this time last year being a cramped 70 mats on the floor shelter to being 120 cot facility with cots and mattresses and increased bathrooms, like that work in a year is just it's unfathomable almost. When you try to put it all together, and just that work that was done by the folks here, and it was not easy, and I've seen the work they put in, and it's even hard to understand how they got it all done. But I know everybody, like when we opened the first isolation site, we basically opened it in 24 hours, and every staff was assembling furniture and making sure all the rooms were set up. Like it's just like it's a quite amazing what happened over this last year, and it shows in our kind of COVID numbers in the population and that. So I think that's the challenge. Keeping distance is a big challenge. Keeping staff, PPE was a challenge at first. We have enough PPE now. Now it's just making sure staff are vigilant about wearing it all the time. That people coming through doors are wearing masks and they're keeping distance. That's the big challenges. But people seem to really respond well, and appreciate the work that was done to make sure we can keep everyone safe.
What I love about you and your vibe, like I mentioned before, is like you don't think anything is impossible to solve. Like you have this, I don't know if it's optimism, it's kind of a realism, because you've seen it and you can do it, and you're like, we can figure this out, let's just figure it out. And I think that's such a refreshing attitude compared to the like, it's just too hard, or whatever. Where did that come from? Was that instilled in you at a young age to just be like, let's just solve this problem and go on to the next one? Or where does that come from, that mindset?
Yeah, I don't know. I've never really thought of it, but I think it's just from my experience. Like I think when I was younger, like when I was 18, 19, I did a lot of like, kind of the anarchist punk kind of community stuff, like Food Not Bombs. It was just like, just dumpster dove, or like went to store, like the local organic stores, and picked up whatever they had left over and made food and served it, right? Like it was just like, there's extra food, it's going to waste, and we can just cook it and serve it to people, and that you don't have to like do anything special or have permits. I mean, maybe you do have to have permits, but those kind of things are like pretty negligible when you think about the stuff. So I think there's often barriers put in your way and stuff. And then when I started working at Spence, I just realized if you can find funding really to do stuff, there's nothing stopping you from doing it, right? Like, and that's then you get in the challenge of you can't always find funding to do the things you want to do, but you can keep working until you do. And I think that's just I had the amazing opportunity that I had people like the Winnipeg Foundation, like, United Way, that just like never said like no. They maybe said you have to wait till next application cycle, or but no one ever really just said no. They just they presented what their challenges were or where their limitations were, and then you just had to work around it or find another way or find someone else to support it. But I never really got no a lot in my early work at Spence, and that's just kind of instilled with me that like there's no reason we can't do it. And then the times where we did get hard no's on things, I was just like, well, like, we're a community, let's just do it as a community, and we'll volunteer, or we'll figure this out. And I know that it doesn't always last sustainably that way, but at least it doesn't stop you from doing the things you want to do and making that stuff happen. And it should, like, it never should. And I always try to never block anyone's ideas, and I've always tried to be conscious of that, and I hope that I've never done that, because I know no one did it to me, and they presented reality in terms of like, you have to do this, or you can't just work 24 hours a day to make that happen. And but no one ever outright said no about things, and I think that helped me kind of just never want to say that to myself or to anyone else.
It is a punk rock mindset, and I love that. And I think part of the tragedy of the mainstream representation of punk rock is they completely ignore the community mindset, or the aspect of it, where everyone is like, if you've never been in a circle pit and been fallen down, you'll understand what a community mindset is, because you get pulled straight up and make sure nobody's getting hurt, everyone's taken care of, you're all family in there. And I think that kind of comes through when you're working in the nonprofit sector. It's like, we're all on the same team here, we're all here for the same reason, let's sort of paddle the boat in the same direction. Sorry, go ahead.
And social justice is just built into that, like, hand in hand, right? So I learned like all my stuff from the anti-racist action folks, and that work, and that kind of anarchist political stuff, where it's like, it's not about destroying everything, it's about building communities that work on a local level. And I think that's what we do well here in Winnipeg.
100%. So do you ever have a struggle coming up against, when you came up in that system, or with those values, and now you're kind of working within systems that need to be adjusted or changed? How do you sort of battle that dichotomy of wanting to affect change, but being maybe somewhat burdened by systems that were put in place before you got there?
Yeah, I mean, like, systems generally suck in general. But like, I mean, like, yeah, like it's tricky, because you do have to work with what's out there and what exists, and it's very clear that there's parts of our government that doesn't work well, and there's parts that do, and you just kind of learn to navigate. And I think that's what I've done successfully over my career, is just figure out ways to navigate. If you're not getting the right support or right answer, go a different route and try a different door. And there's people within systems always willing to help, and always willing to open a door or give advice. And so I think you just always can't be afraid to ask, and can't be afraid to like have those conversations, or just challenge something. And sometimes I've challenged things and got told that I did the wrong thing, and then you learn from that and you grow. And I think that's all you can really do. So yeah, I think it's systems are designed never really for the people they serve, but for the people that work in them. And so I think it's really getting the people that work in them to identify where their flaws are, and learn how to kind of work around that. And I think that's a lot of the stuff we do here at Mainstream Project, or in general the nonprofit sector, probably wouldn't exist if the systems were built better and led by community. But we're not at that point yet, but we can keep working to get there.
So this brings me to the essay you wrote for the upcoming publication that the Winnipeg Foundation is putting out, basically looking to the next 100 years of Winnipeg. And one line that you wrote in there that I want to quote is talking about the role of philanthropy and the role that it has to play sort of within the next 100 years of our city. And the quote is, "Until we change systems, we need philanthropy to fill those gaps." And this is kind of lends itself to what we're talking about now. But can you expand on that a little bit as far as the next 100 years is concerned when it comes to philanthropy? Like, it's weird working in this sector because you're almost working to put yourself out of a job in a way. Like, we don't want our jobs to exist because that will mean there's no more need for, the things that we're trying to solve. But maybe just expand on what you think the role of philanthropy ought to be in society for the next 100 years compared to what it is now and what it has been in the last 100.
Yeah, like I mean, I think and I think I didn't understand for a long time what it was. Like, I think I always thought of philanthropy as a value add, right? Like, it's addition to good core services. And I think, as a Canadian, I think we're, we grew up very proud of our universal healthcare, but I think we don't think about where those limits end, and how universal isn't quite universal for everybody, right? And so I think, working in a health organization now, and working for the WHA, and a few months ago, you really realize that that's a system where so many not-for-profits exist just because of the failures in our healthcare system, specifically like mental health, addictions. Like, those systems just either were never supported to do what they're supposed to do, or never developed properly, and they're always considered a little outside of healthcare. And I think that's where philanthropy really had to step up and support that. And I know we see philanthropy a lot in the healthcare system, and getting infrastructure built and things like that. But I think when you see people that are directly harmed by the system, it's really hard to not want philanthropy to fill that gap, and have it do that. But it really shouldn't, right? Like, I think philanthropy should be the value add to our core services, right? Like, make what we have better through philanthropy, but not solve the problems and fill the holes, right? And so I think that's what I was trying to get at in that essay, is just to try to imagine a city where we had an investment where we needed, and the investments were there, and then philanthropy was able to play this role of adding to it, making it better, bringing equality and equity to the systems, versus filling the holes that the systems are leaving behind. And I believe that should be the case, and I hope it doesn't take 100 years to get.
No kidding. So what are some things that the average Joe can do to improve the situation and change the system slowly to make things a little bit more equitable? Like, just average Joe sitting at home that's like, yeah, it would be nice to help things out. Like, what would your advice be for those people?
Yeah, I think look at your community, like look at your needs in the community. I think I just think back to this winter when it got super cold there, and everyone wanted to help people who are like hanging out in bus shacks, and popping up residents there, and I had people from every neighborhood reach out to us, and some people I know, like friends of mine, and I was like, well, if you have someone in your bus shack, like, the solution shouldn't be to ask us to come out there and visit them. Like, you have a local community center or something, right? Like, every community has a local space, like, like, get that open, like, get volunteers in there. Like, it's clearly that person's in your community, they're part of your community. And I think people forget that, they like to, it's easy to think that the homeless population is on this end of Main Street and in this pocket, and that's it. But that's not the case in Winnipeg. It's everywhere. And we see it, we see it in where the encampments pop up, where people are popping in bus shacks, like where our van is getting called out to respond to. It's all over the city, every area, right? It's not, and I think local people could do a lot to just, organize neighbors, support people. I mean, like, support people before they're in the situation where they're homeless. Like, I don't know that, I don't know the number on it, but the amount of people that are one paycheck away from being homeless, or one, medical emergency, or one, accident away from being out of a house, or, losing your job and being out of that, like, is huge. And we can stop this before it happens, just by like talking to our neighbors, and figuring out organizing local food drives to fill pantries, and little things like that can go a long way. And then we're hopefully not needed on our end of things, in terms of needing the shelter or needing that space, because we should be just an emergency service. We shouldn't be the place people go for months or years to sleep at night, right? And so, like, I think that's where people can do a lot in their community. And then Obviously, like, donating to the places that they care about, and every dollar, as at the foundation goes a long way, and can have a huge impact. And I know it's weird with COVID, the volunteer opportunities in terms.
Mhm.
We've had to scale ours back, and we even tried to stop it, but our volunteers wouldn't stop coming. They just kept showing up every week for like food bank and stuff, and so we decided we had to like quickly figure out how to do it safely and space them apart and get them the PPE. But yeah, there's lots of opportunities to volunteer, get involved, get engaged. But I always encourage people to do stuff on your local community level. Find the people in your neighborhood who need the support, and because it's hard to ask for help and it's easy to offer it, right? And so I think if you can get your neighbors together and identify who might need their fridge filled 1 week or 1 month, right, that goes a huge way in terms of preventing issues down the road, and people being homeless in the future, right?
Very well said, for sure. Yeah, that old adage, "It takes a village to raise a child." I mean, it should be, "It takes a village to just raise a city," right? Like, we're all in this together, and I think that it's weird that that needs to be reminded to some people who think that they live in a bubble within themselves, and others struggling doesn't affect them at all, because it absolutely does, right? And yeah, it's just sort of
Yeah,
a
and
weird.
that's that piece about addiction too. Like, I mean, so many people have weird. They're totally fine with like alcohol, and then like drugs, they don't. They're just against and anti. And like addictions, right? It's a health issue. It needs
Mhm.
that way, and I think people can do a lot to like educate themselves and reduce stigma, and that'll go a long way in terms of like the things that's holding us back from having safe consumption sites in our city, manage alcohol programs, like, is all just about philosophy and beliefs and what people believe. And we just like if we wouldn't do this to any other disease, right? We wouldn't treat any other disease this way, but we do it with addiction, and it's weird, and we need to stop it.
Well, yeah, let's dig into that and maybe pivot a little bit towards your experience in with the WHA and stuff. I'm struggling right now with the um, focus and intent behind keeping everyone physically healthy and virus free, but we're not at all as vigilant in keeping people mentally healthy, and all the anxiety and depression and addiction that's going to come from this pandemic, and all the sort of things that are put in place to protect people are actually going to harm them in a different way. Am I off base in thinking that we're not at all focusing on the mental pandemic, the mental health pandemic, and we're only focusing on this physical pandemic? Or what are your thoughts on that a little bit?
Yeah, it's tricky. I mean, I think there's been some initiatives and some effort to, get people connected online, and there's lots of great kind of things happening on small scales that I see pop up every once in a while. And yeah, I think it's tricky because we built a public health system to only respond to those physical things around virus, infection prevention and control, right? And so the system's not designed to take in those bigger factors. And I mean, I know people, you hear about people who've been warning us for years that this was going to happen, but I think in general we didn't have a good sense that this wouldn't be anything bigger than a bad case of the flu, or that kind of mentality. And so I hope it means that we start investing better in public health, and that this work around addiction, mental health stuff in terms of as a public health response is invested in and supported in the same way we do the physical prevention control stuff we're doing for COVID in terms of our public health orders. And so yeah, I think you're probably right on in terms of there's not enough happening, and that, but it's also I think we've seen our system taxed to the max, right, in terms of its capacity and where we're at. And so I hope that um, we grow from this and we build a healthier system to be able to respond in all ways in the future. And this should be in our memory for a long time as we keep deciding on how we invest in healthcare, and hopefully that changes overall.
Yeah, that's one sort of silver lining of this whole pandemic epidemic situation, that I'm hoping people realize, like, okay, the way certain things were run back, before COVID, like BC, we can't go back to it. And people are like, when are we going to go back to normal? And when are we going to get things back to how they used to be? And I really don't think there's going to be we're not going to go back to that. And I hope that translates over to policy and funding and investment and understanding where we need to put our resources, because this is shining a light on a lot of inequities and a lot of issues that were kind of hidden before, still there, but not really in the public consciousness as much, perhaps.
Yeah, and I think like I hope we do that as as consumers as well. You think about all the, I'm sure we've all had a moment in this pandemic where we were like, what did I really need all that stuff I had, or spend money on going out and doing what are the things that I really want to do again, and need to make sure that they're there when I want to go in the future, right? Like, and so I think just like that whole reevaluation of it's easy to get caught up in trends and stuff, but I think that this is a lot of the chance to slow down and say what's really important. What are those things I want to and I thought about this a lot, like where do I want to spend my money during the pandemic, and tried to support every restaurant I could that was my local restaurants, and order and pick up versus delivery service. That it's cold and you don't want to do that, those kind of things that you can do to really and it's like getting back to that that kind of punk idea of just like you support local things that you care about, and they're your community, and these things should be built into our community in every aspect.
Very well said. Yeah. One aspect, or I don't know where I was reading it, but I didn't know you were chair of the Rainbow Trout Music Festival. Is that still the case?
Yeah, I still am. We
cool.
Meeting last night, so we're not having a festival again this year. Like we obviously couldn't do the gathering in August as planned, and we were planning. We were trying to imagine what the festival looks like if we did something, podcasts and online and all this stuff. And then we had a bunch of plans written up, and we just said, the thing that makes Rainbow Trout such an amazing music festival is about being on that land, the music together, that camping and we'll never be able to recreate that, in an event in because that's not what we do. And it's never what we did for the last, 10 to 13 years, however long it's been. So we said, if we couldn't do it in the way that brought the magic that we love so much with the festival, then let's just wait another year, and hopefully by next year it's all good to go, and we can plan better and use this time to make it even better for future years. So
for sure. Yeah, my first time going was the last time they had 2 years ago or whatever, and a big group of us volunteered, and it was like one of the best weekends of my life. So like, yeah, things like that, and having them taken away, even just like going for beers with my hockey team or my volleyball team, like it's really made me reevaluate the value of community or redefine what community is. Growing up, you kind of think community is the community center and, all that stuff. But community is like who you spend time with and what you do. And when those things are taken away, it's really made me realize, okay, community needs to be prioritized more than I had, and maybe like more gratitude for the communities that I was a part of, as opposed to just thinking, it's just a hockey team or just a volleyball team or just a music festival or whatever the case may be. How are you maintaining your communities when you're not allowed to, gather with people outside your household? Have you found any tricks or things that have worked for you over the pandemic?
Yeah, I don't know if I've done a good job of this, actually. I've always had this. I'm like things that are in front of me, I can really pay attention to. But if like when I used to travel a lot when I was younger, and I would never ever want to call home, or I was gone for a year at one point working overseas and stuff, and I maybe called my best friends once, and I was just I'm better it's there. I'll get back to Winnipeg. It'll be there. And, but while I'm here, I just want to live this way. And so that kind of I think, affected me. And I think of some of my best friends I maybe had 2 Zoom calls or 3 Zoom calls with, and it's not the same, but it's just we're not gonna be able to see each other. So just us, and we're not apart or whatever. And so I'm not good at that. So I started a new job, which is super busy. So that's how
yeah.
But keep things going. But I haven't talked to any of my friends I played soccer with, this whole whole time, things like that, besides like occasional emails. So
Mm-hmm.
yeah, I'm not the person to respond to this well. Like I have like my partner Jody, and we just got a puppy, and
Oh,
that's kind of like my house is my community. And then the folks I work with,
yeah.
at the WRHA, I had great coworkers, all the team of public health nurses, and the outreach workers that I worked with. You see them every day, right? And then here, really connected to the folks on the team here at MSP. So
Yeah.
they're kind of the communities I tend to gravitate closely with because I work with people every day. And
Mm-hmm.
that,
For sure. Well, it's just strange times. It's just such a bizarre, unprecedented experience for sure. Yeah, going back to Main Street Project and sort of the 5-year plan, or I don't know how you guys are focusing on things, but it's a pretty big ship, and you're now at the helm, and you got kind of get to steer it in a certain direction. What are some things that you really want to focus on, either strengthening or moving the needle on when it comes to public perception or understanding or anything? Where do you want to drive this ship for the next 5-10 years?
yeah, I mean, I don't know. I have the things I want to do. Like my things are really about making Main Street Project, the best possible, provider we can be of our services, building strong staff supports and, health and safety stuff. And those kind of pieces around operations, like really, like we run, like, yeah, it's amazing what we run on how we run it. Like on a, it's hard to talk about a, multi-million-dollar budget being a shoestring, but it is, right, when you think about what we do and how much we do. So I think, like, for me, we're about to embark on a 5-year planning process, and I'm super excited about that. And that was like what I cherish the most about being at Spence, is that it was led by a community who developed plans from the community, and that set the path forward. And I hope that this process of developing our 5-year plan here really builds that sense of community from the people using our services to our staff being engaged and stakeholders in this process, and then partner agencies. Um, None of this work happens in a silo, and wanting to really build strong partnerships and make sure that we cover a broad spectrum of work overall. And we know Main Street Project can't do it all. And at times maybe they tried to do it all. And I'm not knocking that because I get it. But figuring out, what is the core function for Main Street Project, doing that really well, and then making sure we work to advocate and make change so that we're not needed longer term, right? And I'd love to see us transform into not being an emergency shelter and more supportive transitional housing, but until everybody has a place to go, and that's not the reality right now. And so we have a lot of work to do to get there and figure out how to transform emergency services into longer term wraparound supports. And that's a building housing stock and transitional housing and supported living and all those things, proper addiction treatment programs that are available to everyone, all that stuff that all these things we have wait lists for. We need to eliminate all that and get people services when they need it and where they need it. So if I can have a role in improving that and better system coordination, and I'm really excited about end homelessness's coordinated access plan they're rolling out. It's long overdue in our city, so I'm excited to know that they're moving forward with that, and we're going to be a part of that here. And I think hopefully everyone's a part of that, because that's what coordinated access means. And so there's things happening that I'm excited to be a part of, and I'm excited to kind of figure it out. I obviously told myself I wouldn't set any super clear direction until we had a plan in place, and then I'll give that guidance. So right now I'm just focusing internally on our staff and our programs, and what supports we need to build in, and how to offer the best possible programming possible.
I love what you said about asking the community what they need and then responding to it, because I think that's a subtle change in the last, I don't know, couple decades worth of philanthropy, where it used to be someone coming in and saying, here's some solutions to your problems, here's some money to solve them, go do it how I want you to do it. And we're learning, and we're trying to make it known that you can't do, what's that saying, nothing about us without us. Like, you have to have everyone at the table who's going to be affected, and have the conversation start like that. So I think that's Have you always had that mindset? Did you learn it throughout your career, or do you just, was that something inherently built in you?
Yeah, I mean, I think I learned a lot of that at Spence Neighborhood Association. I
Mm.
always felt that way. Like, and I mean, I did my degree at university is international development studies, and so um, I think like a lot of the challenges I had with studying that was like a lot of development isn't done that way. But I learned about all the great projects that were, and you look at places like Kerala and India, and these there's tons of shining examples of when development is led by local communities, how much more successful it is, how it's still there 15, 20 years after the projects have happened, right? And so I think that's what I learned, started learning in school, and then saw in reality at Spence Neighborhood Association about a community improving itself, and asking for the things it needs to do that. And I think we want to see that here. And I think we're huge advocates here of peer-led things, and getting the peer involved. And the Manitoba Harm Reduction Network is leaders at kind of that peer-led model stuff. We're doing some of that with, like, we have a peer program here for our daytime outreach, and we'd love to see that. Like, I mean, I think we would say we're very successful if all of our staff are former clients of Main Street Project at some point, or something along that line of peer engagement. We create more positions here that are peer led and people with lived experience, and bringing that in. And so that's things I hope we move towards and can do, because I think people who have lived the life know better than anyone else what's needed in those times, and can provide that better than anyone else.
Very well said. Could not have said it better myself. I know you're a busy man, and we're at the end, like past the end of the day for you. So before we go, we have a little segment called Just Because, where I ask you about the causes you care about and sort of the effect that it's had on your lives. Are you okay to go through the same 7 questions with me?
Yeah.
Okay, great. Question 1 is, what is the very first cause you ever remember caring about?
Ooh, like ever?
Or just like the first one that really moved you, perhaps, or the
Yeah,
first one you were
I would
passionate
say
about.
I'd say Food Not Bombs. I think
Mm.
it got me really into the community, and into the helping out, and feeding folks, and food related stuff. And I mean, we were doing Food Not Bombs before food security was called food security, back when hunger or whatever we used to call food security before that. And so I think that's probably the first one
For
caused.
sure. Yeah, that's a cool because I read that in your bio or wherever I think you wrote it in the essay, and I was like, hey, I remember hearing about that org, but I never knew about it, and it looked pretty awesome. So yeah, very cool. Question 2: if money and politics and logistics and budgets were no issue for you, you could just snap your fingers and something would happen in your current cause area. What would you do?
I would, yeah, I would build housing. I'd build housing. I'd build supportive housing. I'd build different models. Congregate living, shared housing. A new model of a rooming house. Like, just build housing, and places for people to be safe, and safe, supportive housing. That's what.
Yeah, those basics that everyone sort of takes for granted: food, shelter, clothing, love. Once those things are handled, people's experiences are just so much better. So yeah, very
And
very
you can do it
well said.
all in one house. So
Yeah, there you go. Question 3: what's the biggest stigma or misunderstanding about the cause?
I think the stigma around drug use, and addiction is so high. And I mean, I think we saw it very clearly with all the Bruce Oak stuff in St. James, and um, that attitude towards what it means to provide addiction support, and how we stigmatize that community, and the homeless sector in general. Is the stigma we put on people is sucks, and hurts. Yeah.
Something I've come to the conclusion of lately, is that the stigma, it makes it worse for the person experiencing addiction. Like, like it makes them harder to to approach the problem. I used to think of stigma as kind of like, oh, they're just stigmatizing it, I don't know really what I'm saying, but basically I'm saying, like, for the person to want to get better and be better, if they feel stigmatized, they're not going to do it. I didn't really understand that nuance until recently.
Yeah, and I think working in the Street Connections van every night through the last year and a half, almost 2 years, the most amazing people I connected with, the people that care so much about their community and other people who use drugs, and more compassion and care there than I've seen in a lot of communities. So yeah, that stigma is wrong, and we got to get rid of it.
Yeah. Question 4. What's the time in your life where you had to pivot because plan A wasn't working out, so you had to go to plan B?
Yeah, I mean, I guess starting at Spence was my big pivot, because my plan was, I came back from a year of working overseas, and was going to finish my degree and head back to work development job, and then I just saw Winnipeg's core, and the challenges we faced, and the challenges of the effects of colonization and residential schools on our communities, and just had to, I couldn't just go work somewhere else. I had to work here and do that. So that's, I think, the biggest pivot,
Beautiful.
my planned path.
Right. Well, thank you for making that choice, because yeah, I've been saying to people whenever your name comes up in conversation at the foundation or just friend wise or whatever, I'm like, this guy should be the mayor. Like, I want you to be in charge of stuff because you have the best perspectives, and you got my vote if you ever choose to run. So
I find that offer every day.
Yeah, probably wise. That's why you'd be good at it. Question 5. What's the best advice that you've ever been given?
Oh man. I don't like, I can't, like, it's not like a piece of, like, it's not like someone said something that stuck in my head. But I know when, when I was at Spence and we were very early days, I just wanted to, like, I wanted to do, like, manage our youth programs differently, and get into, restorative justice and learning about that. And I think that, there's a guy named Richard Kennett who worked for Manitoba Justice, and he was just so super supportive, and just like, he never said no to anything. And, I think about that, and just kind of like the stuff he taught me around restorative justice, and he got me into, like, victim offender mediation training, and learning that stuff. And I never actually practiced that stuff after doing the training, but it just helped me shape how we developed programming at Spence, and how we ran youth programming from a restorative justice lens. And I think that, like, just like, I don't know if it's advice, but it was just like good learning that kind of helped me shape my view on approaches to how you manage discipline or behavior management in settings like drop-in after school program type things. You can do it in a different way, and it doesn't have to be a punitive thing, and kind of getting rid of that kind of punitive elements of justice and learning that, I think. If that's advice, then maybe that's what it was. I just know it stuck with me in terms of learning that really helped me shape and change how I approached kind of different things.
For sure. Yeah. Awesome. Question 6, sticking with advice. What advice would you give your 10-year-old self if you could go back in time and give him one little nugget of advice?
Oh, I just think, have the most fun you can doing everything you do. And I try to do that. I enjoy my work very much, and I always have, and any opportunity to build fun things into your job. And I think, I think I've done a pretty good job of living life to as much as fullest. But I think about times where I didn't do things, or I held back on doing things, or I was tired or whatever, and I kind of wish, like, just never not do things, and always go to do the most fun things. And they're not always the same for people, right? Like, everyone's fun is different, but just, like, have fun all the time. And things are hard, and I know that's kind of like that's like a gumdrops and baby puppies kind of answer, but just, like, have fun, and even doing fun stuff, like you can do good passionate hard work stuff that is fun, and make it fun, and have fun. When you're doing hard things, make them fun, and it's okay to have fun, and laugh when things are really bad, and make fun of that. And I think that's lessons I've learned from people who have been in much worse situations than I am, and they still find ways to have fun and be happy and joke around. And I think if everyone does that, we'll get, it brings connection to other people, and also helps you, get through life in a better way. And that's not to diminish, mental health challenges and depression and those things that are very serious things. But if you can make fun, carve out fun in whatever you do, I think you'll be doing well.
you have to survive when when you're working in this world, when you see the things that we see and talk to the people that might be struggling. You have to find a way to encourage fun and have fun yourself, otherwise it'll beat you down for sure. Question 7, the very final question. Thank you again for doing this, man. You've been an awesome guest. Question 7 is, what do you want to be remembered for?
I want to be like, if I can make real change in our city, then that would be great. But I think less. I don't know what people think of me, but I want to I prefer that the memory of me stands in people that have been able to have an impact on my life and support. And so it's not necessarily like, a memory of my career or my work, but just that that I've been able to have an impact on people's lives in a positive way. And I think that would make me feel good to know that in the end, I was able to, help one person or help 1,000 people, whatever it is, or a million, whatever being that people felt that I was useful and helpful and gave opportunities where there wasn't any.
Beautiful. Jamil, thank you for being on the podcast today. Good luck in your role moving forward. Enjoy the new puppy. Be safe, be happy, have fun, and thank you for talking to us.
Thanks. So great chatting.